Hey everyone, my name is Matthew Manda. I am a fourth year medical student at the Michigan State University College of Osteopathic Medicine, and I'm very excited to talk to you all today about my second year Peru trip. The quick presentation is called Ojos Nuevos, or that means new eyes, and the title is Seeing the New Challenges of Global Medicine in Peru. So quickly, what we'll be talking about today is just kind of an introduction, pre-trip Peru, and then kind of what happened afterwards. So pre-trip, my goals, I've always wanted to go to Peru. We were able to go to Machu Picchu beforehand, and it was amazing to see one of the seven wonders of the ancient world, got to go fishing for piranhas, got to see monkeys, sloths, go through the rainforest, and actually even celebrate my birthday there. So it was a really fantastic opportunity to not only see amazing things, but also improve my medical Spanish and my clinical skills. So those were my main goals going into the trip. And the trip started in Lima, Peru. We were able to visit one of the oldest medical schools in Peru and hear some great public health lectures to understand the culture and the medical conditions that were most important to them. We were also able to hang out as a group around this beautiful beach town, as well as go explore some of the hospitals. I am interested in family medicine, which includes pediatrics, so chose to go to the pediatric hospital and saw a lot of awesome ways that they are able to take care of their kiddos there. So after being in the capital, Lima, we switched over to Iquitos, Peru, where we were able to provide care to an area that essentially can't be reached by car. So people have to go by boat or by plane, which means they're fairly resource limited. And it was really great to apply finally some of the skills I've been learning in medical school, some OMM on individuals, be able to provide injections for some painful scarring. So that's the kind of log you see there, as well as learn how to get better at reading x-rays with many of the amazing physicians that were there, and then provide care accordingly. And so after we were in that city, we took a boat down the Amazon River to some rural villages and were able to assist with providing care there. Often on the trips too, there are some research projects, and I was able to be involved with the oral health project, which was a lot of fun. It was beautiful and both a great learning experience, but also one that I'll never forget in terms of having a really great time with friends and meeting new people and new cultures. And so while there was a lot of medical things, I think there was a lot of things that I was able to learn about myself and kind of my future goals in medicine and what I want to be able to do and help people. You know, in addition to my initial goals, I was able to make lifelong friends. Many people that I still talk to today as fourth years. It's great to see them around the hospital, build some great mentors, which is actually very helpful for when you go into your fourth year rotations, and then even build some friendships with patients. So, you know, in the bottom, you'll see a picture with me and Ms. R. She's a patient that actually came back for follow-up because we were there for multiple days, and found me on the second day. And we talked for actually hours, and she asked if when we took our photo together that we look at each other eye to eye because she wanted to feel seen. And that was something that she had had a really difficult time feeling. Since she and a lot of her loved ones have experienced chronic disease, she felt very isolated as many of her loved ones were no longer there. And that was something that was really interesting for me to see, is how chronic disease for both elderly and even the youth, you know, with a lot of the oral health issues that we are studying, is really affecting even some of these very rural or resource limited settings. So that was really great to kind of, I think, open my mind and think critically about how I can potentially help these populations in the future. And, you know, just generally speaking, it's nice to help people feel seen. Additionally, I think being in Peru really improved my confidence in my clinical skills. Just being able to master it with real people, real patients, with real experts in the field who donate their time to us as students. And I'm just so grateful for the confidence that they've given me that I still carry to me as a fourth year now. It helped me become creative with problem solving in resource limited areas, and it provided me a lot of inspiration, and most importantly, those ojos nuevos, or new eyes, in terms of seeing the world differently and hopefully being able to carry these skills forward to better care for people and build a career where I can continue to help people feel seen. All right, thanks everyone, and I hope that you are able to have fun on your own Peru trip in the future. All right, take care.
Hi, my name is Rebecca Gores. I'm a current fourth year medical student at MSU COM. During my time here at COM, I've had the opportunity to go to Guatemala, Peru, and Cuba. All three of these trips were absolutely incredible experiences, and I highly recommend all of them. I'd like to talk a little bit more about the Peru trip today. So this is a trip that you take during August of your second or fourth year, but the preparations actually start in January. It's completely student run, so you get a lot of great leadership experience learning how to plan, coordinate, and fundraise a trip like this. In addition to that, we also have great research opportunities on the Peru trip. I actually served as the research coordinator the year that I went. Some of the projects that we had were HPV and cervical cancer, pediatric oral health and their diet, and looking at creating a biosand filtration device to provide clean drinking water in the Amazon. There's many other projects, and it's very easy to get involved on either your own project or join one that's already going on. After months of hard work, August finally comes around and everyone is so excited to see their hard work pay off. Your first day in Iquitos, when you arrive at clinic in the morning, there's already a huge line wrapping around the block waiting to be seen. We offer various specialties of primary care, OB-GYN, peds, dermatology, podiatry, dentistry, even radiology. And we see a wide variety of pathology, so it's a great learning opportunity. In addition to medical care, we also get to have a little bit of fun and explore the vibrant and rich culture of Peru. There's an optional excursion to go and hike the Inca Trail up to Machu Picchu. You can also go piranha fishing and take a canopy walk across the top of the Amazon rainforest, among many other things. The overall goal of this trip is to have a positive impact of the people in Peru. We're often their only access to medical care, and they're incredibly grateful for our presence. In addition to our 2 weeks there, we have relationships with physicians in Peru so that we can leave approximately 6 months worth of medical supplies so that they have some continuity of care throughout the year. On a personal level, this trip was truly invaluable. I gained leadership, research, and clinical experience. I developed lasting relationships with my peers and mentors, and I was able to immerse myself in a beautiful and rich culture. I hope that this video was informative and that it made you excited to apply to Peru or any of the international trips. They're all amazing, fantastic experiences, and I highly recommend them.